Wrist and hand ganglion cyst. A ganglion cyst is a fluid-filled lump under the skin. It is often found over a joint or in a tendon in the hand or wrist. The ganglion cyst forms when there is a small tear, herniation, in the sleeve of thin tissue covering a joint or tendon. The tissue bulges and forms a sac. Fluid from the joint leaks into the sac and causes swelling. Ganglion cysts are typically round or oval. They can appear suddenly or slowly and can disappear on their own. They can also reappear for no reason. They vary in size and in many cases grow larger with increased activity. With rest, the lump typically becomes smaller. Small ganglion cysts can be pea-sized, while larger ones can be around 2.5 centimeters in diameter. Some cysts are so small that you can't see them. They are known as occult ganglions. They can also be soft or firm. They may or may not be painful. When they occur on the back of the hand, they are called a dorsal ganglion cyst, the most common location. And when they occur on the palm side of the wrist, they are called volar ganglion cysts. Causes. No one knows exactly what causes a ganglion cyst to develop. Women are more likely to be affected than men. Although they are typically seen in people between the ages of 15 and 40, they can be seen in very young children as well. These types of cysts also tend to develop more frequently in people who repeatedly stress their wrists, such as gymnasts. Repetitive wrist or finger activities may increase your risk of developing a ganglion cyst. People who have osteoarthritis are at higher risk of developing ganglion cysts near the joints. Joints or tendons that have been injured in the past are more likely to develop ganglion cysts. While most lumps and bumps of the hand and wrist are ganglion cysts, there are other conditions that have different treatments. Some types of tumors such as a lipoma or giant cell tumor, carpal bossing which is a bone spur, and other conditions can cause lumps on hand and wrist. Symptoms. A bump beneath the skin is the main sign of a ganglion cyst. This bump can vary in size and shape. It may grow larger over time or when you use the joint more. Ganglion cysts usually are painless. But if a cyst presses on a nerve, even if the cyst is too small to form a noticeable lump, it can cause pain, tingling, numbness or muscle weakness. Diagnosis. Your doctor will discuss your medical history and symptoms. He may ask how long you have had the ganglion, whether it changes in size, whether it is painful. The doctor usually diagnoses ganglia by physical examination. A lump's appearance and location are telltale signs of ganglia. The doctor may press on the bump to see if it's painful. The cyst should not adhere to the skin, and the skin should have a normal color. One test to diagnose a ganglion cyst is to hold a light source, such as a small flashlight, against the cyst. A normal ganglion cyst will transilluminate, meaning light will pass through the cyst indicating it is not a solid mass. Radiological studies are typically not necessary, but some doctors will obtain an X-ray just to ensure the anatomy and structure of the hand and wrist is normal. X-rays will not show a ganglion cyst, but they may show other problems, such as arthritis of the wrist or a bone tumor. If there is a question about if the bump is a cyst or something else, imaging tests including ultrasound or MRIs can be helpful. Treatment. Ganglion cysts often go away without treatment. If the cyst doesn't cause pain or discomfort, treatment isn't necessary. Anti-inflammatory medication may minimize swelling, easing mild levels of discomfort. Splints or braces offer support and stop you from moving the affected area, reducing swelling and pain. For patients with bothersome symptoms, an aspiration of the ganglion cyst is suggested. The fluid is drained from it. However, the patient should be informed that more than half of ganglion cysts treated with aspiration will recur within approximately 1 year, because the root or connection to the joint or tendon sheath is not removed. Aspirations are most often attempted for ganglions located on the top of the wrist. Ganglions on the palm side of the wrist can be tricky to aspirate due to their proximity to major vessels and nerves. If the cyst recurs rapidly within 2 to 4 weeks after the first aspiration, a second aspiration is unlikely to be successful. However, if the cyst recurs after a longer period of symptom relief, closer to 1 year, another aspiration may be attempted. We do not recommend injection of ganglion cysts with cortisone based upon evidence that there is no added benefit, and there is a potentially increased risk of subcutaneous fat atrophy and skin depigmentation. Closed rupture of ganglion cysts on the dorsum of the wrist using hard tools, like a book or a coin, is generally thought to be unreliable and is not a recommended treatment modality. It'll work very temporarily, but the cyst will almost certainly come back. And each time it is smashed, you get internal bleeding and scarring. This makes the other options more difficult and less likely to work in the future. Your doctor may recommend surgery to remove the cyst if your symptoms are not relieved by non-surgical methods, or if the ganglion returns after aspiration. Surgery involves excision of the cyst along with its stalk. This may mean excising part of the involved joint capsule or tendon sheath to ensure removal of the root of the cyst. Even after excision, there is a small chance the ganglion will return. If not properly removed, the ganglion may recur postoperatively. Approximately 10% recur with surgery. There may be some tenderness, discomfort, and swelling after surgery. You are usually able to resume normal activities 2 to 6 weeks after the procedure.